Here's another interesting and a graphic example how the ravages of these diseases can be totally halted. During World War II, Norway was one of the countries that was occupied by the Nazis, and when the Germans went into all those lands between 39 and 45 and removed all the livestock, chickens, goats, pigs, cows, whatever animals were there, they took them off the land. And interestingly enough, the native populations were forced to subsist on whole grains and legumes and vegetables and fruits. That's all they had left. Their heart disease plummeted. Absolutely plummeted. And that's how they found out, one of the ways they found out that it was the animal products that was causing the diseases. When the war was over and they were, all the animal products were made available to them again, the heart rate skyrocketed. I think this is a huge lesson in public health about the cause and cure of one of our most dreaded diseases, heart disease. However, unfortunately, this message has not been heeded by the medical profession or by the public. It's just the reverse. As I mentioned earlier, people in other countries like Asia, if they come over to our country and start eating our standard American diet, called, the acronym for that is SAD, Standard American Diet, they take on all of our diseases as well. When they go back to eating their way, their cultural way of eating, they do not have the diseases that are rampant here. As a result, I think I mentioned this earlier, coronary artery disease is predicated to become the #1 global disease burden by 2020. Rural China, the Papua Highlanders of New Guinea, Central Africans, the Tarahumara Indians of northern Mexico, and those who live in the Andes have lived long lives and do not have the epidemic of heart disease that we have. And this is really heartwarming news. Dr. Campbell says that if you don't have a heart attack or a stroke, you will have the gift of dementia, Alzheimer's, and frailty. I see that firsthand with my mother. My mother's going to be 96 next week, and she has dementia to such a degree that she only knows the moment, and I'm not exaggerating. She doesn't know 5 seconds on this side or 5 seconds on this side. If I say we're going to get our nails done, she's in the car, where are we going? If we just got our nails done, or I'm calling my brother on the phone in the car, and he'll say, what are you doing? Oh, I don't know, Carol, what are we doing? You know, she has no idea where she's been or where she's going. And it's really sad for me. We tried to have her in our house, and it didn't work because she also has severe incontinence. So I had a very difficult time taking care of her. So she is in assisted living. She's fine otherwise. She's strong. She walks with a walker. She looks forward to her meals and her games. And, you know, I'm grateful for that. The good news about her is that she knows me and she doesn't wander. So I have to take that from her situation. Do you wonder why about any of this? Does it make common sense to any of you? If we can eradicate these diseases, then why don't we? I can tell you why we don't, because the big industries, the beef industry, the poultry industry, the sugar industry, the dairy industry, they're not going to put out any major campaigns that say, don't eat this, because they would be cutting off their nose to spite their face. It's all about the money. We have to take the responsibility for our own health care. Our doctors aren't going to do it, and the big industries aren't going to do it. It is definitely up to us. If you don't get anything else, I'd like you to walk away from today with this. Don't follow blindly what your doctors tell you to do, because in many cases they don't know. There are a lot of good doctors out there, but my husband was sick from 2000 to 2007 or 8, I believe, off and on, heart disease and cancer, and told he had diabetes also. And I mean, we have been in and out of doctor's offices, I can tell you, for him. And I was his caretaker, and I would go in and ask questions and, you know, go in with my research and say, you know, what about this, what about that? They didn't want to hear it. They did not want to hear from me. Not only did they not want to hear from me, I've got most of my story written in my books, I won't go into it now, but they were, the arrogant ones were awful. They hardly ever even looked at me when we were in the office with him. And he wanted me there. I got the details for him and everything. They did not want me there. So I've had my own experience with the doctors, and I can tell you I'm not happy with them, most of them, the ones I have had experience with. Maybe you've got doctors in your family, maybe some of you are doctors, I don't know, I don't mean to bash the whole medical profession because it's good in its place. Antibiotics are good in their place, emergency doctors are good in their place. But to rely on them every single day when all they wanted to do was pass out prescription medications to bill, then that's not right. It is not right. And we take the prescription and we go home and not get it filled. That's what I mean about taking, control and responsibility. Sugar diabetes, well, what used to be called sugar diabetes, I guess it's called just diabetes now, but, well, I'll get into that. Anyway, I have a friend who's on statins and many other pills, and I have implored him a couple of times. I don't want to get on my soapbox too much because I know people don't want to hear it usually. That's why I'm glad when people like you are interested in this sort of thing and you ask me to speak about it. But anyway, I tell him that he's taking poisons. So he said to me one day, Carol, I went to my doctor and I told him that I had a friend, meaning me, say my medicines are poisons. And he said, Jerry, keep taking your poisons. I don't know. To me, he doesn't want to know anything else, and that's following your doctor blindly. He doesn't want to know, he doesn't want to read anything. I'll give him information to read, and he doesn't read it, so just don't follow blindly. People think that if they don't eat beef, they're doing all right. I'm here to tell you that fish and chicken have as much cholesterol and fat as beef does, and in the end, they take their toll. Plus, fish has mercury and other contaminants in it. So if you think you're doing yourself a favor by eating chicken and fish, think again. Dr. McDougall says that sugar doesn't cause diabetes, fat does. Because the fat gets in and clogs the cells, and the insulin isn't able to penetrate the fat to get to the cells. So it's more a case of fat. When you get the fat out of your diet, you're able to reverse the diabetes. Dr. Barnard has a book called, I think it's called Reversing Your Diabetes. It's in the back of the resources. Reversing Diabetes, Esselstyn and Pritikin. Pritikin's in California and Esselstyn's in Ohio. They are pioneers in reversing heart disease. And they sort of came upon it at the same time at opposite ends of the country. So people who were told they had to have heart surgery never had to have the surgery when they followed these doctors' diets, which is a plant-based diet. And they also go as far as no oils. No oils. Olive oil, no oils. I haven't quite gotten there yet because I do like a vinegar and oil salad, but no oils, none. No oils are good. The epidemic of diabetes does clearly indicate that current efforts at prevention and treatment are failing. Diabetics take drugs, they follow the diet prescribed by the American Diabetic Association, and still go blind, lose limbs, and get heart disease. I know for a fact that when Bill watches his diet, his sugar numbers are down. And my history with diabetes is that my grandmother I'm talking about type 2 diabetes now. Type 1, you can control it greatly, but you can't ever cure it. Type 2, you can cure with diet. My grandmother went blind as a result of diabetes. My mother comes from a family of 10. And she's the only one who doesn't have diabetes. All other 9 aunts and uncles of mine had it, had neuropathy in their legs, which rendered walking totally impossible. And some of them were on insulin, some of them were on pills. But I don't want to go there, people. I don't want to go there. And genes, you might wonder, well, if it's in your background, you're predisposed to get it. You're not. There's a whole misinformation about genes and being genetically predisposed. Yes, it's in my background, and that's exactly why I'm doing what I'm doing, because if I don't change my way of eating, yes, chances are very, very great that I will succumb to all the diseases that my family has had. And as I said, they've got all 3, the heart, the cancer, and the diabetes. If I change my way of eating, then my chances are much greater that I will not succumb to those same diseases that my family had.